Thank you, Chairman Harhart, Chairman Redshaw, and members of this committee. I truly appreciate the opportunity to address you this morning at this informational hearing on HB 765, and I'll be very brief in my remarks because you have a tremendous panel of testifiers who will be offering their expert thoughts on both sides of this issue this morning, and those are the individuals you really need to hear from, not me. But I simply wanted to provide some of my reasoning behind introducing this bill. This legislation is very simply about accessibility and affordability to quality health care, and that's especially in our most rural and urban areas that we believe are currently underserved. Now, groups such as the AARP, Rural Health Association, Federal Trade Commission, and the National Governors Association believe that this legislation will help the physician shortage in these areas. Now, many times when governmental bodies encounter and identify a problem, the first instinct is to create new regulations, more bureaucracy, and at the same time, most of the time unintentionally, more barriers to actually addressing the problem that they identify. I'm trying to address this problem of accessibility and affordability to health care in Pennsylvania by doing the opposite, removing what I feel, and I think many feel, are burdensome and unnecessary barriers to this accessible, affordable, and high-quality health care. What I'm not trying to do, I'm not trying to start a battle between healthcare professions. I'm not trying to break up some kind of a medical team, as I've heard stated over the past few months. In fact, I believe that we have a member of that team that is currently being underutilized, undervalued, and if we can operate in a little bit of a different manner, could bring a lot more to that very team. Those team members are nurse practitioners. I believe that they have the ability to provide that kind of care that so many in our Commonwealth need. And hopefully they can provide that kind of care if some of those restrictions are lifted on their profession. So I'm more than happy to work with both parties represented here today as we look to provide the best possible care that we can for my constituents, our residents here in Pennsylvania. So thank you once again for this opportunity, and I look forward, as each one of you do, to hearing from our panelists this morning. Thank you.